I spend a lot of time thinking about technology strategic planning. Where is this going? There are certain things today that are very trendy, and I chose that word very intentionally. So everybody and their uncle is talking about deep neural networks and AI. I think it's blown out of any sense of proportion to reality. Will it help with refractive outcomes? There's no question, because it's a numbers game. Would it have discovered anti-VEGF therapy, which is the biggest thing that's happened in ophthalmology in 100 years? No. I mean, we have a cure for wet macular degeneration, diabetic retinopathy, vein occlusions, retinopathy, prematurity, because Napoleon Farrar discovered VEGF and made molecules that trap it. AI wouldn't have helped, okay? Cataract surgery, AI wouldn't have helped. It helps with refractive outcomes. It wouldn't have resulted in the invention of vitrectomy. It's not going to solve, so it's not AI, even though everybody in their uncle is talking about it. What about 3D printing? Their bio 3D printing is part of a very complex process of turning induced stem cells, induced pluripotential stem cells into appropriate cells in the right 3D architecture. Injecting stem cells makes a tumor or a lump. Injecting appropriate tissue for the space, retinal pigment epithelium, rods and cones, requires building that construct, sort of recapitulating embryologic development outside the body. And there is a room for 3D printing, but it's been blown out of proportion. In the operating room, better visualization is crucial. So moving from strictly operating microscope to electronic visualization, that's real. Maybe there's a place for robotics. There's some challenges there that what people promote today are not going to work. They shouldn't even get FDA approval, because if you have a needle in somebody's eye hooked up to a robot and the patient moves, it's over for the eye. And people tend to hand wave to try to get over that. Nanotechnology depends on how you define it. There's some room for some progress there. A lot of it today is, the real progress is driven by biology types. And so I think, for example, we're not there yet in dry macular degeneration, which is 10 times more frequent than wet. So something's got to happen with dry. Gene therapy is wonderful, but it's niche, and it doesn't restore lost vision except one disease, RPE65. So gene therapy's got to go very early. Stem cell really can result in developing the right type of cells for truly regenerative medicine, vision restoration. So I'm more interested in building tissue from the stem cell base than I am in gene therapy.